One of the things that I find personally very helpful in moments like this, when we are all having to do a lot of reflection and deep thinking about our country and our state, is to look around us. And one of the really beautiful things is being in a space like this. We have so many organizations in this state and in our country working incredibly hard to make a place where all people want to live and where we all can feel respected and cared for and advocated for. So on that note, I am happy to introduce to you today Tracy DeVries, who's the Executive Director of the Women's Foundation of Mississippi, and Lorena Quiroz-Lewis, the founder of Immigrant Alliance for Justice and Equity. These are two organizations who are fighting to ensure that all Mississippians have access to resources and have some amazing things to share with you, both in terms of the work that they're doing throughout the year and how they got started, but also their response to COVID-19. So again, thank you all for taking the time to be here. We are happy to have you here, and we look forward to a really beautiful discussion. And hopefully you all will leave a little uplifted, or a lot uplifted. I know I certainly am when I talk to them. So with that, I'm going to turn it over to Tracy. So Tracy, welcome. We're happy to have you here. And if you would be so kind and take the wheel.
Sorry, I'm just unmuting and sharing my screen. It'll take 1 second to, I think, be really ready. Oh, and please meet my dog, Courtney, who you can hear in the background. He gets a little bit jealous when I'm not paying attention to him. So hi, everybody. My name is Tracy DeVries. I'm the Executive Director of the Women's Foundation of Mississippi. And I thought I might tell you a little bit about the organization itself, share a little bit about some of the gender disparities that women and girls in Mississippi were facing before the pandemic, and then a little bit about how that's affecting women and children currently, and what we think we might see next. And then also talk just a little bit about our current response and what we think we're going to be looking at doing coming up. And I'm happy to answer any questions along the way. So the first thing is the mission of our organization is economic security for women. So we invest in organizations across the state that are focused similarly. One of the things that I think is interesting about our organization is that because we have the word foundation in it, I always find myself having to explain a couple of key things. So we are a foundation, but we're a public foundation. And so what that means is that we raise money every year, just like every other nonprofit does. We are sadly not endowed by Serial or by anyone with the last name Buffett. We do have some endowment funds, but again, those are things that we've actually had to raise and then invest as endowment. So in many ways, we're a little bit of a hybrid entity with the Alliance. We do grant making, but we also do annual fundraising. And so, I think in many ways that allows us to sort of see the reality and feel the pain of all of the nonprofits that are trying to get through this moment in time, while also having the lens of philanthropy. So I think the other thing to just share sort of quickly is, again, what we do and where we focus. As I said, we make grants. Our grant focus areas for the last several years have been around what we call access to opportunities. And that's really supporting women who are seeking largely 2-year degrees or other skills training programs to get them to whatever that next level might be in terms of potential for salary benefits and all of those good things. We also do what we call a 2-generation approach, and that is, sometimes you'll hear it called whole family, but it's meant to focus on parents and kids and ways to support both in lifting out of poverty and education focus, all of those good things. It's often tied directly with more early childhood development programs too, though we sort of focus a little bit more broadly than that. And then we also have a healthy women focus. And so for us, that has largely been around preventing teen pregnancy and sex ed and resources around that. We also provide some supports around just access to quality care. As some or most or all of you know, we have a rather high infant and maternal mortality rates here in Mississippi. And those are things that can be fixed with the right resources. So, and then in terms of programs, in the last few years, we've added some programming work for the organization, but it's largely focused on leadership development and community engagement. So we have a new project called the Mississippi Women's Policy Institute. We're about to enter our second year, which of course is going to be a really interesting thing because this is meant to be, it's an experiential fellowship with training programs and lots of like training and in-person contact. And so we're trying to figure out how to move all of those things virtually. And so essentially what we do is we provide the training program for women who are interested in becoming active in policy advocacy, and then they pick their own project that they want to work on and move forward on trying to get legislation passed successfully. They're currently looking at equal pay. We're the last state in the country to not have a bill on the books for our state for that. So we'll see how that goes over the coming, hopefully, weeks. We also do a program called She's on Board. We found that women who were seeking board leadership roles were having a hard time sometimes stepping into those roles, not because they weren't qualified, but because they felt like they hadn't had the training program to do it. And so we actually put together a program and have worked with some folks who've been involved with the Alliance, specifically on the financial training piece, which that trainer is fantastic. We've done sessions called Consider This, where we do panels and share information on a variety of topics. We've talked about mental health. We've talked about sexual harassment in the workplace, all kinds of things. Courtney, come here. Thrive at Work is a new program that we've been looking at, and that's to talk about positive workplace policies for women and for men, obviously, but positive policies that are really working for both employers and for employees. And frankly, I think that's something that's become even more important over the next year or two as we come out of this. Like, one of the things that we're seeing a lot is childcare is a huge, huge issue, and it's probably going to remain so in new ways. It already was, but now it's even more so. And then we also have a website that we run called Fact Not Fiction. It's focused on evidence-based, medically accurate sex education for teens, but it's also meant to focus on providing resources for parents and other trusted advisors in a teen's life to be able to have accurate information, to have thoughtful discussion. So that's who we are and where we're focused. I think the thing that is really important to be thoughtful about, at least for our organization right now, is really where women are and girls are in our state right now. So a couple of years ago, actually it was back in 2019, it seems like a couple of years ago, back in 2019, the Bill and Melinda Gates Foundation put out a report on gender inequality and what that meant. And essentially what they said from that was that in general, across the world, it doesn't matter where you are, that boys' worlds will generally expand at the same time that girls' worlds are actually contracting. And part of that is about something that they call unpaid work. And so the value annually, by the way, of globally unpaid work is apparently $10 trillion. And that unpaid work is oftentimes around childcare, possibly elder care, taking care of family, home, all of those sort of responsibilities that we all do but don't necessarily get paid to do. The point, though, is that there's a trend where girls and women are much more likely to be engaged in that work. In the US, the average is that men spend about 2.4 hours a day or 17 hours a week. in this unpaid work, and girls spend 4 or more hours a day, and or I should say women, sorry, 4 or more hours a day, and 28.5 hours a week on unpaid work. And so for me, my concern is that I think that's actually increasing during this crisis. I think we're seeing more, a lot more things happening in the home, particularly in homes where there are children and young children who are needing care and are not in school or are not in some kind of other child care program. Some other things that are just, that have always been true. Mississippi is number 50 in the country for women living in poverty. We have the most. Women of color are disproportionately affected. That is true when we also look at the wage gap. Mississippi has one of the most significant wage gaps in the country. And again, women of color are more disproportionately impacted. For women living in poverty, also, one of the things that I think is important to note is that childcare can actually represent up to 25% of a salary of a mom or a family. And that's an awful lot when you're looking at someone who is living at or around the poverty line. So those are just some of the things that, you know, we knew coming into this. And I think, you know, some of what we're seeing now is how that's playing out. So women are more likely to be in the kinds of jobs that are being lost right now. So the leisure and hospitality industries, retail, education, health services. And they're also somewhat more likely to be in some of the higher risk jobs for exposure as well. So they're sort of being doubly impacted right now. In terms of men and women who have lost employment recently, it's about 3% more women than men. And so, you know, when I'm looking at what's going on and trying to understand, you know, what role the Women's Foundation can play, I'm really being thoughtful about simple basic needs. Workforce development opportunities. So, you know, one of the things I know is that there are a lot of federal dollars coming into our state soon and now, and you know, we need to really understand how we as a community can offer workforce development programs that can get folks who are out of work into new work fast. I do not claim to have all the answers to that, but it's definitely one of the spaces that I'm really interested in for all of us, for men, women, everyone, obviously for women, specifically for us. And then of course, you know, childcare and basic needs are really big issues still, and that's going to be ongoing. I think, you know, the childcare, I think, is going to become a huge issue, and I'm hearing about this from across the country. From other women's funds and women's foundations. Everybody is sort of hearing this concern where, you know, you've got a couple of scenarios going on. One is you have women who must go to work, do not have an opportunity to work remotely, and are having to make horrible decisions about what to do with their kids to be able to continue to work. And then there are women who are having to make decisions. There are women who are being who may have access to childcare but are not entirely sure if that's the case and are having to make decisions about that. So there's a lot going on in that space specifically. So, sorry, my husband is home and he's causing some drama with my dogs. I apologize to you all. From the very beginning of when the coronavirus became evident and we knew that we were going to have something to do, we said, okay, let's figure out what's going on. So we brought together all of our grantees, our current grantees, and asked them to come and share with us about what they were seeing, what they were thinking they were going to need. And the response by and large was really similar in that folks had some things that they thought they were going to need to help with any remote working or to help students with technology so that they could actually finish their courses. It was around personal hygiene products, access to food, all of those kinds of things. I think one of the other things that we heard was that there was just a lot of, there was so much uncertainty that folks were really having a hard time getting out of the next week or 3 weeks or 4 weeks and trying to figure out what they might need 6 weeks, 6 months, a year down the road. So we decided that one of the things that we were going to be able to do was provide support to to nonprofits that we were already working with or had a significant relationship with. So we decided that we were going to create a rapid response fund. We basically turned around, we had about maybe $20,000 to work with, and then ended up bringing in another $100,000 within the space of maybe 3 or 4 weeks, I guess. Again, we had to go and find that new money, but we thought, you know, if we're in a position to reach out to and bring some money into Mississippi, we should go ahead and do that, and so did. So we decided we were going to go ahead and open up a rapid response fund. I'll talk a little bit about how that worked for us and what we're looking at next in a second, but I'm not going to read through every single one of these, but our round one, we finalized towards the end of April, and were able to provide $55,000 in funding to 11 organizations. You can see on the screen, a lot of it was really focused on sort of these emergency one-time needs for folks. There were some requests for some mental health counseling. And then we also had some support requests to support childcare centers. So we turned around that fairly quickly. You know, one of my favorites is up in Tutwiler. You know, they make their lovely quilts, and they pivoted immediately and said, we're going to make masks. We're going to pay our ladies to make masks, and we're also going to feed our community. And so they continue to do that now. So after our first round was done, we took a look at it and we said, okay, how did that go? What more do we have to give? And we went ahead and did a second round, and we are currently in the process of finalizing distributions this week to another round of organizations for a very specific number, as you will see, $64,997. But it's very much in the same vein as the first round, with support for basic needs, those kinds of supplies, some childcare stipends, also looking at just, sorry, I lost my train of thought. Yes, sorry, all the same stuff. I wanted to just point out a couple of them though. You know, I think that domestic violence is on the rise across the country, and that's something that we're going to continue to see, and that certainly impacts women and families. So I think that, you know, we're going to see a lot more of that and a lot more need in those places. And I think we're going to also end up seeing a lot more need for those who are most marginalized already. And so finding ways to get to those groups, I think, is going to be really key. We're also, though, seeing things like Mississippi Center for Justice that's looking at legal advocacy programs. You know, to me, that's sort of a pivot where we were initially looking at literally like, in this moment, this is what I need today. To I think a lot of folks are now starting to get a little bit more to a place of this is what we need today, but also we think this is what we're going to need tomorrow based on what we're seeing. So again, this is our full list of what we provided funding for in from the end of April until basically this week. So we were able to do this because the size and structure of our organization allowed us to have the flexibility to do this rapid response funding. A lot of larger foundations have a harder time turning around money really quickly, which is unfortunate, though I have seen many of them try to do that and do it effectively. We worked on a variety of things to make sure that we were still managing our due diligence. You know, due diligence is always one of those things that's a little bit tricky. You have to do a lot of work and vetting to make sure that your investments are sound. So that was one of the reasons that we were working with organizations that we had worked with already or knew quite well already. And then I think, you know, one of the things that I would also add, and I know that you all know this, and for anyone on the philanthropy side, I wrote general operating as queen because we're a women's foundation, so I can't say it's king. But you know what I mean. It's I think one of the things that we have been grateful for are for some of the funders who have come to us and said, it's okay. If you need to make changes to your budget, that's okay. If you need to do something different, that's okay, just let us know. And so I think that as funders, that's something that is really important, and that's something that we've tried to embrace in the funding that we've been giving out. But it's also something that we're trying to seek and that we're trying to advocate more broadly for, because I think for many of us, it's going to be really hard to know exactly what we're going to need in the coming months, in the coming year. So our office continues to work remotely. One of the things that has actually been great about this is that we've been able to move literally every payment that we have to an electronic payment, whereas before we spent an awful lot of time cutting checks. So we got a little bit sleeker in 2020 with that. And now we're focused on pivoting back to our traditional annual grant making, identifying the programs that we run that we can actually go ahead and run virtually, and or trying to find safe ways to do things in person and in small ways. I wish that I owned some kind of outdoor air conditioning company, because honestly, it seems to be the only way that you can actually get together, but it's too hot. And then, we're also trying to see if we can secure additional funds outside of what we had already planned for the year to continue to do this kind of rapid response. But it's certainly tricky to identify those dollars, but we continue to see where there might be that opportunity. And then my last slide is just some photos from some of the folks that we were able to provide funding for. And so, yeah, that's where we are, and that's what we've been doing. And I'm happy to answer any questions or concerns, ideas, what have you.
Tracy, this is amazing. Thank you very much. I would love to open the floor to Q&A. We'll take a few minutes, so feel free if you have a comment or question, feel free to ask it now, either in the chat or feel free to turn on your mic. Tracy, while we're waiting, I would love to ask, one of the things that is, if you look at the number of grants that you gave, most of them are pretty small. I was wondering if you could take a second and talk about the strategy around why they are smaller, but also in the time when we are really trying to focus on diversity, equity, and inclusion. I saw that you have quite a spread of geographic regions in there, and we spoke last week about how philanthropy and grant makers can really focus on ensuring that dollars make it to organizations who are at a higher risk of being overlooked. And so I'm wondering if you could talk a second about your strategy around the grant making process.
Yeah, so I mean, our typical annual grant making process is robust, right? Like we have a grants committee, and the grants committee goes and visits people and asks questions, and people have to write, nonprofits have to write pages and pages and put together budgets and all of these things, which is, needed. But that's also really time consuming and hard to do, especially when you're also managing a crisis with your teams, right? Like, so we didn't want to do all of that. And so that's part of why we were focused mostly on organizations that we already had worked with before. So we'd already done our due diligence. We'd already checked, are you really a nonprofit? We'd already done that kind of work. We also chose the $5,000 amount because the organization already has a discretionary fund opportunity up to $5,000 that does not have to go through our formal process. And so rather than me trying to figure out how to change our governing documents, which we may get to someday, but I knew that was going to be a much longer thing to have to work through, was like, let's focus on the $5,000. $5,000 can buy a series of computers, it can buy Wi-Fi, it can buy a Zoom account, it can buy food, it's not going to save an organization, but it can help someone, it can help get through something that is right now. So that's why we ended up with the amount. It was literally like, that's what we could do within our own structure. We also thought that it was going to be easy enough to create an application, and the application was very simple. Please tell us what you would like to pay for. Tell us a little bit about who you serve, which we already knew, really. And okay, because we need to have something. If we got too many requests, we need to have something so that we could figure out how to manage that. But in the end, we actually were able to support all but one organization that applied to us, and that organization was because they were applying for something that was probably going to happen next year, and we just thought that's not what this was for, but we're going to hold this for our annual grant making. So we were ultimately able to actually provide funding to everyone who'd applied to us to date. Some of them not quite as much as we wanted to, but that was the reality of what we had to work with. But our organization often works as an intermediary. So we'll work with larger foundations and do smaller grants, right? So like, you know, while the Kellogg's are giving out 6 and 7 figures, which is great, we all want and love that, thank you so much. You know, for them managing some of the, like a $25,000 or $50,000 grant is just, that's a lot, right? So they'll work with organizations like us, and we have several outside of Kellogg that we work with, but they'll work with us and say, you know, we know that you work in this space, we do too. We're going to give you some money so that you can invest in these ways. So we've always sort of had this spirit of trying to find those who might benefit from a $25,000 and $50,000 grant in a really significant way, but probably might not have the time to write those massive grant applications too, right? So that's something we've always done. And then in terms of who we funded, you know, we really wanted to be sure that we were getting to organizations that were maybe not finding funding elsewhere. And again, our focus is on women specifically. So, you know, we had to keep it in that space. But, you know, I had someone call me or email, I guess, several weeks ago, and was basically said, like, I'm literally just giving money from my pocket to trans women because they are struggling. And I was like, from your pocket? And the answer was yes. And I was like, well, okay, let's see if we can do something about that. So, you know, they're just folks out there who you know, it's hard to get all of those dollars. So we just thought, well, what can we do with what we have actually available to us? And because we're sort of this hybrid nonprofit foundation thing, we also sort of sit in the space of how much do we really have? Like, how much can we get out? And so that's what we're really focused on right now, is like with what we have available and what we think we can have over the next 6 months, 12 months, 18 months, like where can we direct that? And I'm really interested in making sure that we're directing it towards the women and girls and kids who are really just outside of the usual funding systems.
Wonderful. And then one last question. Could you say a little more about your policy work? This seems so important, especially in Mississippi. What kind of reception are you getting from elected officials? And I hate to put a time frame on it, because I'm sure we could spend a long time talking about policy, but I do want to make sure that we stay a little bit on target with time. So if you could try and answer that.
Yeah, I mean, I would just first say that, you know, we actually, part of the reason we created this program was because we wanted to have more women involved in the process. And it also helps us as a 501c3 to maintain our C3 without having to take our H election and deal with all that paperwork. So we're participating in the process by giving other people access to the process, right? Like that's the point. So we're not even promoting our own agenda, if you will. Like, we're not saying to these fellows, this is what we want you to work on. We're giving them broad, like, we need you to focus on economic security for women issues, but we're not giving them our policy agenda. And I would say that, you know, by and large, we've had a really warm reception to the idea. And by and large, it's probably, you know, it's not, I'm sure that there are folks who would not be thrilled about entering more voices into the system, but I haven't heard that directly. We have been able to work with both parties somewhat successfully, and I would say that women generally are interested in seeing more women participating, even when they don't agree on issues completely. But, you know, over the years, we'll see how that actually turns out.
Wonderful, thank you. There is another question that just came into the chat, but I want to make sure that we do pivot and try and stay on schedule. So feel free, Tracy, to, if you don't mind answering that in the chat, or we can try, if we have some time at the end, to circle back. And that came from Alicia Jones. Tracy, do you link up with others who are trying to combat the same issues, like the Mississippi Black Women's Roundtable? Yeah. So thank you, Tracy, for taking the time. And I'm going to do a little bit of an interlude here. For those 31 organizations and individuals who are in the room right now, I want to make sure to remind you that we have trainings going on all the time, including this week. And so just to highlight, here is our training calendar for the month of June. We have one tomorrow in our Quick Bite series on using social media in your communication plan, but we also have 9 others coming up in the next few weeks. So definitely, please sign up for these. And just to help encourage you along, I want to highlight our 3 for 3 plan. So what that means is, if by the time this webinar is done, if you go and register for 3 trainings, one of them is going to be for free. So go online. I'm going to put our training link in the chat. You can go and sign up there. You do not have to be a member of the Alliance. And definitely encourage your friends and other organizations. These are not necessarily just for executive directors. These are for all members of your staff. If you want to look at professional development, these are really, really well developed and taught by some amazing folks. So please take advantage of this. We would love to see our training rooms packed. And so with that, I'm going to turn it over to our next presenter and register quickly. But I want to introduce Lorena. She is an amazing individual doing incredible work and just started a nonprofit here in Mississippi. And so with that, Lorena, I'm going to turn it over to you to tell us a bit about the work that you and your organization are doing. And while you're starting to talk, I'm going to make you a presenter.
Thank you, Dave. Good morning, everyone. So a little bit about myself. My name is Lorena Quiroz. I am originally from Ecuador. I'm an immigrant. So the work that I'm doing is a personal, it's a work of the heart, I would say. I was born in Ecuador, migrated to New York, and I've been in Mississippi for 22 years, about 20 or so years of public health experience. And I just happened to be organizing with Working Together Jackson when the August 7th, 2019 Mississippi raids occurred. So it's kind of like I was at the right place at the right time with the phone number of Mayor Lumumba and some allies. And so that's where it all started, that phone call to the mayor and the allies, what we call the press conference when the raids hit. Now, the raids that occurred on August 7, 2019 were the largest reported raids in the history of the United States, where 680 people were detained, mostly undocumented, but a good number of people had work permits. Some were even residents. And this impacted, of course, thousands of children. And it was heard across the nation. And because it was, we had organizations from the region, national organizations come down on that day to try to support the work that was going on. From those raids, the 680 people that were detained, they were held overnight. There was a lot of despair around what's going to happen to the children. The schools made plans, try to provide a little bit of housing, food, and we didn't know what was going to happen. But 24 hours later, 300 people were released, and some with ankle monitors, some with court dates, and 380 were moved to first 2 detention centers, then 3, then 10, all over Mississippi, Memphis, and Louisiana. So organizers from the region were all over the place looking for folks. So a little bit of that background as how we got started. Because of all the mayhem and different folks on the work, me being a Mississippi organizer, I kind of set myself in the center and said, hey, this work needs to be led by immigrants and somebody from Mississippi. I believe I've been in Mississippi for 22 years, and I have 3 Mississippi-born women. And I believe that we are bright. We are just as capable of leading our own work. And we just get a bad rap, right? because of the racism and the structural racism that we have been dealing with for decades, generations. And so I ended up leading the work, which was the Immigrant Coalition, and we organized in 5 different towns, in Canton, in Carthage, in Morton, and Laurel. And as we began to organize, we work with institutions, we work with churches in the area, mostly Catholic churches, but also Episcopalian and some Baptists. And we, as organizers, we develop leaders. We don't believe people require our help. We believe they just need resources. And so that, to me, it was essential, because we're working with families that cross continents. And I would like to say the families that were original of this continent, they were here originally. They just kind of walked over north and looking for a better life for themselves, for their children. They were detained at work, right? They were detained at work. And these were folks that were working 10 to 12 hours a day so that their children could have, I want to say, what I benefited from. You know, I'm a privileged immigrant right now because my parents did that work. And so now I have a little paper that says I'm a citizen, and that allows me to live without that heaviness, right? That I might be, well, I may still be pulled in now under this administration. And so as we organized with the 5 comités, which we call it in popular education, which are in English as committees, I realized that there needed to be something to tie them together. So what we called it was La Alianza, the alliance, and we came up with the name of the Immigrant Alliance for Justice and Equity. Because as we deal with immigrants and immigration and legal, there's always that health side, right? That intersection of race and health and immigration. And that's what happened. We became a charitable organization. Our fiscal agent is the Black House Project with Natalie Collier. And we're excited to say that we've been doing some work within these 5 towns. Most of the work was legal at first with the intakes, and we worked hand in hand with different attorneys from the region, mostly with Mississippi Center for Justice. Amelia Stetman has been my partner in crime for a long time, where we were kind of rogue people just doing know your rights trainings all over the state. But now we both have institutions. And so we provided those know your rights trainings. And because of the nature of that work, it's such emergency, right? People were still being stopped by ICE. People there were retenes, so there were people being held, just stopped. One case I want to mention where a woman was hit by a car. She was hit by a car. Her car totaled. The person ran away when she went home. The police kind of circled her home, found the car, and brought her in. So because we were organized now, right? We were able to call attorneys, organizers to respond, and we were able to get her freed. So that was a win for us. Even though there's existing immigrant organizations, there's not a structure. Now there is a structure in the state, and it's led by immigrants, by the working class, by poor folks. And so that is what has happened here under the Immigrant Alliance for Justice and Equity. And we've been hit, with emergencies, as I said. And of course, in the middle of this emergency and people continue to be detained and people continuing to be not granted bail, and then just so many things that, families now couldn't go back to work. They had ankle monitors, so no one would hire them. Benny Thompson came down, and I was privileged to also testify to some of the stories that were told. And I don't know if anybody saw that it was all over the news, but what you saw, what our families portrayed was like, we want to work, and signs. That's all they were asking for. Let us allow us to work. Because they had escaped some terrible circumstances in South and Central America. And that's all they wanted to do, be able to provide for their children. So with the emergency came trying to provide for housing, and that came through the coalition, try to provide for utilities and trying to provide for food. for 600 and something individuals, hundreds of families and children. As things settled down a little bit and we got that structure going, COVID hit, right? So another emergency. And with COVID, now we have our families still in detention center, our heads of households, mothers, fathers, and the concern that they were going to, catch COVID. And we linked up with Detention Watch Network, and we've been doing some organizing with that. We've had also some conversations with Benny Thompson, and he's working on 2 particular people because they, according to ICE, all people with conditions were being released, but that's not happened. We know some people that have kidney problems and lung problems are still there. So we've been working on some campaigns around that, address Governor Reeves, and let them know that this is not just an immigrant issue, but a public health issue. Because what happens inside these detention centers, if our public health system, which is already failing, continues to be overloaded, it's going to affect us. So it's a community issue where, and so we've been doing some of that work as direct, and this is where I'm going to share, as direct response to the COVID, some of the things that we've been doing, and I have a little bit of the structure here. We've been doing a lot of training. A lot of the folks that we work with, they have, their education doesn't go past an elementary level, but they're bilingual and trilingual. So, there's no assumptions made about people's capabilities. These are folks, again, that are amazing leaders. They can keep the budget of their home. So we know that they can be trained to do accounting. We've been training on Zoom, on Gmail, on Docs, on Sheets, Excel. We've been doing a lot of different trainings with leadership on how to hold meetings, the democratic voting process, social media, not just how to post on Facebook, but how to manage, how to make videos to share your stories. We've been doing Know Your Rights trainings. And one particular program that we are very proud of is the Promotoras program. And because of my public health background, it's that CHW program, and that we've tried to do through the health department, but was never actually successful. So the Promotoras, the CHW program, is based on the notion that the community knows best. They know how to address the problems, and this is how public health, whether it's diabetes, chronic disease, best distributes or best helps or responds to the community. Our promotoras are 12 women, some of them, as I mentioned, that don't have education past 2nd or 3rd grade. Indigenous women that speak 2 or 3 languages, with Spanish being their 2nd or 3rd language, that have been trained to do some of this work. Right now, we're beginning to do the actual CDC curriculum training for the promotoras, and they will be fully trained in about 6 months. These promotoras have done amazing work. Because as we know, this pandemic, right, it changes, it varies. We have peaks and valleys when it comes to the amount of people that are sick within each of these communities. But the promotoras at work weekly. They have lists of families that have been affected, and they're able to reach really deep within the communities. Every week they provide lists of families affected, whether they need food, whether they need something as simple as, if they're affected, what they ask for is medication. They ask for canned soups, Gatorades. And we know there's been a lot of conversations around cultural competency and providing culturally appropriate food. Sometimes the promotora says, hey, we just need chicken soup these 2 weeks because we have 20 families that are sick and they can't get up to cook. And so because we have this direct information from promotoras, we developed what we called a program, a way of distribution, dignity, where the families are not having to go and fill paperwork and sometimes endure undignified treatment by the folks that are helping, with questions such as, who's living in your house, there's a man living in your house, why isn't he working? There's so many things that people are subjected to. So so we actually share our budget, what we receive as far as donations or grant applications. And since it's mostly about 99% of the work that came in, of the funds that have been coming in the last couple of weeks has been for COVID, that means that the promotoras decide what to do with all those funds, 100% of those funds. And so we share Excel sheets, they decide what to do, and we just order it, whether it is working with local tiendas, all right? So these are the local stores, or Walmart gift cards, or this week, what they decided was that they would like to have Visa cards so that they can spend the money on other things. So that's the program with the budgeting. We've also been able to get donations of sewing machines, and the promotoras have teams of women that are making cloth masks for free. And so about 90% of the cloth masks they give out to the community, and about 10% they sell so that they can purchase. We gave them the seed money to to purchase the fabrics and the elastics, and now they're able to continue that work on their own. So that's kind of like a little also co-op model that we're trying to build around as we continue to encourage folks to work for themselves. We've also secured a couple of computers to do those trainings. We're still looking for some more computers because the women are ready. They're ready. And what we were receiving at one time was pictures of lists with 100 names on it, right? And that was just too much for me to type. So we trained the 12 leaders to enter these informations on lists on Excel sheets. And as I mentioned before, let's see there. Through the promotoras also, and through the comités, we are talking to leaders that can help do Facebook Live. In the Immigrant Alliance for Justice and Equity Facebook page, you will see some of the work that we've done with partner organizations, the People's Advocacy Institute, the Institute for Minority Health, NAACP, UMMC, some faith leaders from the Catholic Church. Father Sant has been amazing in helping us, where we discuss what's going on in the immigrant community, in the Latino community and indigenous community. We've also been able to partner with infectious disease Dr. Lucas at UMMC, where he's able to break down what's going on. And so we have question and answer. We've also had Melissa Rodriguez, who was at Catholic Charity. She was the one bilingual trauma counselor that is no longer here. She has moved away. So right now, the trauma counselors that we have they kind of receive this 101 training, and she was able to give some information on care, on trauma, speaking to our children, because we give a lot of attention to the adults, but the children need this need the attention that they have been neglected from. I'm sorry, I'm hearing clicks, and I wasn't sure if somebody was clicking me in the computer, but obviously it's something else. So also, we've been partnering with the Mississippi State Department of Health. As of now, we have distributed over 6,000 masks in all over the state of Mississippi, not just in the central Mississippi area, but we've distributed some in the Delta. We're partnering with the regional library in Hernando to the Latino community. And again, we target the Latino community because from my 20 years of being in Mississippi, it's always been like, hey, I'm here, right? Hey, look at me. Latinos are here. We have some numbers that indicate that in places like Morton and Forest, where the census data estimates 10 to 12% Latino or Hispanic population, there's about 25, maybe even 30%. So we know that the immigrant population is growing, not just the Latino, indigenous, Hispanic population, but also the Arabic population. So we really advocate for the increase in language resources. We know that there's funds out there for organizations that receive federal funding that's supposed to be allotted to this work, but it just hasn't because they really don't. Institutions sometimes feel that it's not an issue, right? And that's why organizers and this institution that's based on organizing with immigrants for immigrants, teaching leaders that it's their right to have information in their own language, to have it translated, and to ask for it is essential. So it's not a top-down approach; it's a bottom-up. If we build up the leadership, they will know what to ask for. They will know that it's their right, and to ask for interpreters. Also, their rights as far as immigration. That's something that we're working on a lot because it hasn't been. There's no culture of I would say of social justice in the immigrant community. There's been a little bit of work here and there, but not this deep grassroots work that, and it's not just me, that some organizers that are volunteering right now are doing. So I just want to say the organization is volunteer run. I'm the volunteer director. We have a volunteer communications person, a volunteer, of course, the organizers are all directing, and there's a coordinator for the promotoras. And so a lot of the work that we're doing, most of the work that the organizers are doing are on a voluntary basis. And now, as far as I really appreciated what Tracy said is about doing her due diligence, because that's one of the problems sometimes that we ran into, that we were doing so much relationship building that we're just now starting to write grants. And what we see is a lot of organizations, regional and national, that are not doing this kind of work, that did receive the millions of dollars and hundreds of thousands of dollars. But sometimes if you are not brown, if you don't know what it is like to be an immigrant, what to have lived without your father for 2 years and then finally been able to be brought into this country, worried about DACA, worried about your dad in the detention center, that sometimes you do more harm than good, right? Sometimes you don't understand that there's colorism in our culture. Sometimes you don't understand that white Latinos think differently than mestizos or indigenous people or even Afro-Latinos, right? So we have that within the Latino Hispanic community. And so doing your due diligence when it comes to funding organizations is so essential, that money is put in the hands of the people that are doing the work, and not someone who feels that this is a grant opportunity. Because as I mentioned to some of my colleagues and friends that are working with me, we're trending now. But this is work that has been, it's the skin that we're in. It's a life work that we've been doing for decades. Many of us found ourselves on August 7th, Latinos that have been doing this work statewide. We found ourselves right there, all working, and we didn't have an institution. And again, hence the creation of this alliance, where there's a lot of Latinos that are investing their time and work into the building of this leadership. What resources do we need? The language resources. Remember, we're coming in here, we're trying to work. And so how do we learn the education system? How do we learn the health system? It's not just learning that there's information in your language, but also learning to navigate these different systems. The court systems, they're so different than the countries that we live in. we're in rural communities, so transportation has been a lot of problem, a huge problem. There's the fear of deportation, the fear of ICE, fear of the police, work instability. Right now during COVID, a lot of people had to take off, but they're not being paid. Yet they go home with a letter that says that they are essential workers. So 9 months ago, we were being let go, but now we're essential. So you have that, the fear of public charge with the administration, with all these things that you hear. People are afraid that if they go and report that they've been diagnosed with COVID, that may somehow influence their immigration case and they may be deported. So there's a lot of fear in the community. There's a lot of different issues, and we need help. We need help. So I'm going to go to please forgive me. I didn't have time. Just kind of threw this one together, how we can help and or how you can get involved. And I said all hands on deck. As I said before, it's volunteer run right now as we start continuing to work on some funding. We will be hiring and paying. We do have some funding secure for a hotline. We do have a Mississippi Resist hotline where the communities can call in and be directed to different resources. And so those folks are receiving a small stipend, and that's through the generosity of the McCarthy Law Foundation, who has helped that happen. But right now, the website is upcoming for the Immigrant Alliance for Justice and Equity. You can work through us also through Working Together Mississippi, who's helping this organizing with the institution. But the alliance itself, there's a PayPal.me where we're receiving funds for COVID and other organizing work. Our email is, as you see up there. And these are some of the things that we've been requesting: laptops, gift cards, printers, bilingual volunteers. Dartmouth is working with us. We're actually working on a social justice curriculum in English and Spanish, so that will be upcoming. I'll share that with you, David, where we actually want to center Mississippi and the work and the culture that we want to shape here in Mississippi. Again, students are valuable with their tech support, office supplies, diapers, personal items, iPads. Sometimes people have old iPads in their, in their storage that they want to share. So these are some things that, that we can benefit from. And I am a little bit just excited about what I heard Tracy saying. I knew about her foundation, but I think that there's some work that we need to be kind of stepping back right now and trying to help build up this organization. If you get a minute to check into the Facebook page and see some of the work that we've done and see some of the people that we have touched, and please feel free to do so. Log into the Facebook page at the Immigrant Alliance for Justice and Equity. Also, a lot of people have heard of Mississippi Resist. That was the original project that came in to answer the raids. But as this continues, we're going to continue to grow this organization with the leadership from the communities and with the support of folks like you. And then hopefully, as we continue to work to obtain more funding, we can grow this work.
Wonderful. Lorena, it's amazing. It's just amazing. I think there are a lot of people in this space right now who are just so grateful that you and the alliance are doing, your alliance, are doing this work and are stepping up to make sure that voices that need to be heard are heard, and that resources are made available to communities who have so often been disenfranchised. It's just such an important conversation to have, and I think we all need to raise the attention and the awareness of this. It's something that we don't talk a lot about in Mississippi, but is absolutely critical that we start to pay attention to. And so thank you so much for taking the time. We are unfortunately over time. So here's what I would like to do. If you would like to reach out to Lorena, please do so. We will pop her email in the chat, or actually, Lorena, if you'll type that into the chat bar, we can make sure that you all have the opportunity to connect with her. If for some reason you missed that, feel free to email me, and I will make sure that we connect you. And if you have any other ideas or suggestions, I know that Lorena would love to receive them. She's amazing. I love working with Lorena and have for a while now. And so thank you, Tracy. Thank you for taking the time to be here. And thank you to all of you for again taking another Thursday morning to spend with us. Don't forget to register for our trainings. Don't forget about membership with the Alliance. If you're interested, we would love to have that conversation with you. It is not crazy expensive, and we have a lot to offer, and so we'd love to have you on this journey with us. Let me see here. Please just be safe and be well. And if you want to give us any feedback on the weekly webinars, if you have a presenter that you would like to recommend, we'd love to hear from you. And so if you visit our website, you'll see a weekly webinar feedback survey, and it would really mean a lot to us if we could hear your voice as we try to make this as meaningful and effective as possible. Thank you all. Be well. And Lorena and Tracy, again, thank you for this work. Take care, everybody.
Thank you.
I thank you.
Have a good one.